Well, I think, the way the world is at the minute, we need to look at more closer integrated working amongst all our partners in the NHS, the local authority and the third sector. And I think this is a vital way of transforming the NHS for the better in terms of quality improvements and in terms of smarter ways of working and spending our money available. Well, from our point of view, we're responsible for the residents of Lancashire. And Pennine falls right into that, and it's about making the outcomes better for them. So what we're looking to do is produce quality care, but at the same time, let's get a grip of the NHS currently, and together work together better to make it a more formidable force going forward, and obviously ensure better outcomes and better value for money. One of the most important things that we've got to look at is pooling resources between us and spending together. That way we can eradicate duplicate things where we're all doing the same thing and maybe in our own areas. And our commitment will be to be heavily involved in that pooling and spending together. Again, for the better outcomes for the residents. What we've got to realise is this is going to be much more about place-based care, social care, healthcare. And I think, to be honest, it's going to revitalise them in their day jobs. And they're going to be doing things really that maybe in the past bureaucracy's gone in the way of. And they're going to be on the front line doing the things that they train to do and what they really want to do. So I think it's important that it's embraced by the staff, and we've got some really good staff out there. And I'd encourage them to take this with them. Well, I mean, healthcare is much more about other things other than smoking. It's been traditionally about stopping people drinking, smoking, drugs, them sort of things. But there's a lot more that we can get out there and give people a responsibility to maybe look after themselves a bit better. There's all sorts of prevention things that can be done for far less money than what it costs when they eventually arrive at the door of the NHS. So from LCC's point of view, we're really keen to work with partners, all our partners, on schemes that might make people live healthier longer.